obsessive-compulsive disorder, or OCD. A term so many people use lightly, yet so few truly understand. OCD is more than being neat or organized. It's not about liking things a certain way. It's a mental health condition that can take over your thoughts, your emotions, and your peace of mind. In this video, we'll explore what OCD really is, what it feels like to live with it, the different types, how it's treated, and most importantly, how to support yourself or someone else living with it. OCD stands for obsessive-compulsive disorder. It's an anxiety disorder that creates a cycle between two main parts: obsessions, intrusive, unwanted thoughts or images that cause distress; compulsions, repetitive actions or mental rituals done to try to neutralize that distress. For example, someone might constantly worry that they've left the stove on. The obsession is the fear. The compulsion is checking the stove again and again, sometimes dozens of times, until the anxiety eases, if only for a moment. But here's the painful part: that relief doesn't last. The brain quickly loops back, repeating the cycle. This isn't about logic. The person knows their fear might not make sense, but their brain won't let it go. And that's what makes OCD exhausting. OCD doesn't look the same for everyone. There are many different themes or subtypes. Some of the most common include contamination. OCD, fear of germs, illness, or being unclean, leads to excessive washing or cleaning rituals. Checking OCD, constant need to verify that doors are locked, appliances are off, or something bad won't happen. Harm. OCD, intrusive thoughts of accidentally or intentionally hurting someone. This doesn't mean a person wants to cause harm, it's the opposite. These thoughts terrify them. Symmetry, order. OCD, the urge for things to feel just right or perfectly aligned. Religious or moral OCD, scrupulosity, fear of sinning, offending God, or being morally wrong. Relationship OCD, doubting your feelings for your partner or fearing they don't truly love you. Pure O, primarily obsessional. OCD, intrusive thoughts without visible compulsions. Rituals happen mentally instead. These forms can overlap and symptoms often shift over time. What's consistent is that underlying anxiety, the need for certainty in a world that rarely offers it. Imagine a thought enters your head that you didn't invite, something uncomfortable, even disturbing. You try to dismiss it, but the harder you fight it, the louder it gets. Your brain screams, "What if it's true?" You start to question everything: your memory, your morality, your safety. That's OCD. It's not about being dramatic or picky. It's about feeling trapped inside a loop of fear and relief, over and over again. It often comes with guilt, shame, and confusion. People with OCD are usually hyper-aware that their fears are irrational, yet they feel powerless to stop them. That internal conflict, knowing your brain is lying to you but feeling forced to obey it anyway, is one of the hardest parts. There isn't one single cause of OCD. Research shows it's a combination of genetics, brain chemistry, personality traits, and life stressors. People with OCD tend to have differences in brain circuits related to fear and decision-making. Stress, trauma, or sudden life changes can trigger symptoms. It's also important to note, OCD isn't a choice or a weakness. It's not caused by poor willpower or negative thinking. It's a neurological and psychological condition that requires understanding, not judgment. The good news is, OCD is treatable. The most effective treatment combines cognitive behavioral therapy, CBT, especially a type called exposure and response prevention, ERP. It helps retrain the brain to face fears without performing compulsions. Medication, such as ssris, a type of antidepressant, which help balance brain chemicals. Mindfulness and self-awareness, learning to observe thoughts without judgment, rather than reacting to them. Healing doesn't mean never having intrusive thoughts again. It means they no longer control your life. It's learning that thoughts are just thoughts. They don't define who you are. If someone you love has OCD, don't tell them to just stop thinking that way. It's not that simple. Instead, listen, be patient, encourage them to seek help, avoid participating in their rituals, even if it feels like you're helping. Reassurance only strengthens the OCD cycle. Remind them that they're not alone, and that their thoughts don't define their heart. OCD doesn't make you broken, it makes you human. A human whose brain got stuck in survival mode, trying too hard to protect you. You are not your thoughts. You are not your fears. You are the awareness watching them pass through. With understanding, therapy, and patience, freedom is possible. And if no one's told you today, you are doing better than you think.